Hello everyone, my name is Taylor Jasinski and I'll be presenting on athletes and depression, rates among concussion and anterior cruciate ligament injuries. The purpose of this study was to compare depression rates among athletes who have sustained a concussion versus an anterior cruciate ligament. The design is a cohort study with a cross-sectional design. Participants consisted of 234 National Collegiate Athletic Association or NCAA Division III athletes. Instruments include the Center for Epidemiologic Studies Depression Scale, or the CESD, which indicated if depression was present. The main outcome measure is that differences in scores in concussed and anterior cruciate ligament injured athletes were compared. The results show that athletes with concussions had higher CESD scores the first week post-concussion and then declined. Anterior cruciate ligament injured athletes peaked at 1 week and remained elevated. In conclusion, increased CESD scores in concussed athletes may be from their inability to cope with the stress of being injured. Keywords include concussion, ACL, depression, CESD, NCAA Division III. There are 121 million people worldwide affected with depression, and 14.8 million of them are 18 years or older. Prevalence may be as high as 22% in collegiate athletes. And regardless of the type of injury sustained, there are several psychosocial responses that an athlete may experience. Depression is the most common emotional reaction after sustaining an injury, which can result in depressed mood or major depression. Depressed mood is classified as being down or sad, and major depression is classified as a major depressive disorder, or MDD, which is a medical condition that presents with symptoms of decreased motivation, impaired concentration, and feelings of worthlessness and hopelessness. There are approximately 1 in 10 adults in the United States that report symptoms of depression, and 1 in 5 adults will have at least one episode of MDD in their life. There are twice as many women that are diagnosed with major depression than men. Athletes with no injuries experience less psychological distress than those with injuries. And athletes are likely to report more depressive symptoms post-injury if they have participated in athletics for a short amount of time, and also report less symptoms post-injury if they have participated in athletics for a substantial amount of time. There is a greater risk of depression in athletes with orthopedic injuries than in the general population. Signs and symptoms of depression include irritability, anger, disturbances in eating and/or sleeping, decreased concentration and motivation, withdrawal and avoidance from others, and negative thoughts that may or may not lead to suicidal thoughts. Suicidal ideation is a hallmark symptom of major depression and is increased in injured athletes. It is vital that depression is recognized early on so treatment can be initiated if needed. And about 80 to 90% of individuals that receive treatment for depression have a positive response to it. One of the most complex injuries sports medicine professionals face is a concussion. Broglio et al. 2014 defines a concussion as a trauma-induced alteration in mental status that may or may not involve a loss of consciousness. In the United States, traumatic brain injury, or TBI, is a leading cause of disability. And changes in cognitive, physical, and emotional functioning can change drastically after a TBI. Rates, predictors, and outcomes of MDD after sustaining a TBI are still unknown despite extensive research that has been conducted. There are 444,000 NCAA athletes competing annually, and 12,500 of them will sustain an injury annually. One example of an injury that typically presents with psychological challenges is a torn ACL. After ACL injury, reconstruction is the gold standard for treatment to restore function. 42% of athletes undergoing ACL reconstruction, or ACLR, may develop depression symptoms. Those who score higher on the CESD scale are more likely to have negative feelings towards surgery. And the primary focus after an athlete sustains an injury is to prepare them physically to return to their sport, but there are several psychological effects that can occur. Athletes with ACL injuries experienced more emotional disturbance than those with concussions. And many studies to date have focused primarily on ACL injuries and revealed that negative emotions stem from injury. Different injuries have different patterns of emotional disturbance linked to it. The purpose of this study is to compare depression rates among athletes who have sustained a concussion versus an anterior cruciate ligament injury. The research question being studied is what is the difference between depression rates among athletes with a concussion versus an anterior cruciate ligament injury. The null hypothesis is there were no significant differences between depression rates in athletes with a concussion versus those who have sustained an anterior cruciate ligament injury. This was a cohort study because it assessed the relationship between physical activity and health outcome. It was a cross-sectional design, and it was used to compare depression rates in concussed athletes and ACL-deficient athletes. There was 234 National Collegiate Athletic Association, or NCAA, Division III athletes from both men's and women's varsity sports. There was 106 men and 128 women. They all sustained a concussion or an ACL injury during their season and then were asked to participate. All athletes filled out the Center for Epidemiologic Studies Depression Scale, the CESD, during their pre-participation examination. The CESD scale was used to assess the number of symptoms athletes presented with to indicate if depression was present after sustaining a concussion or ACL injury. This has been used extensively at the collegiate level and is a valid and reliable assessment that was helpful with indicating if depression was present. It is also valid in identifying if depression is present if the score is greater than 16. The Institutional Review Board, or IRB, approved the research being conducted, and informed consent was obtained from all the participants. Permission was granted from the coaches and the athletic director. The day of the concussion or ACL injury, the CESD was re-administered and scored to determine if their rate of depression increased. Differences were compared between the scores of the CESD from the concussed and ACL injured athletes from baseline. The CESD asked athletes to report how they have felt or behaved in the last few weeks. It has 4 columns that athletes use to rank their symptoms, ranging from one day to every day of the week. Athletes were interviewed 1 week, 2 weeks, and 1 month post-injury, and then every 2 months for a year, and completed the CESD each time to track progress. This is an example of what the CESD scale looks like. Answers in the first column, meaning less than 1 day, receive a score of 0. The second column, answers 1 to 2 days a week, receive a score of 1. Answers in the third column, 3 to 4 days, receive a score of 2. And answers in the fourth column, 5 to 7 days, receive a score of 3. The lower the score, the less likely the athlete is to have depression. If depression was indicated, counseling was provided through the health center on campus, or a sports psychologist was contacted. The statistical test used was a repeated measures ANOVA, and it was used to evaluate rates of depression between athletes with a concussion or an ACL injury. Athletes were assessed 1 and 2 weeks, as well as 1 month and every 2 months post-injury for a year. The alpha level was set at p less than 0.05 for all statistical tests. The statistical package for the social sciences, or SPSS software, version 22.0 was used. In conclusion, the purpose of this study was to compare depression rates among athletes who have sustained a concussion versus an ACL injury. Athletes with concussions had increased CESD scores for the first week post-concussion and then declined. Athletes with ACL injuries had scores that peaked at 1 week post-injury and then declined after 1 month. The CESD scale was helpful in identifying athletes that were at risk for depression, so early intervention could take place if needed. The results showed that rates of depression can fluctuate depending on the type of injury and its severity. Athletes with concussions are able to return to their sport much faster than athletes suffering with an ACL injury because they do not require surgery. Major emotional disturbances occur after ACL injuries, which can lead to depression or further injury if the athlete is not mentally prepared for athletics again. Early identification of depression symptoms is beneficial so early intervention can occur. The baseline CESD scores can easily be compared to post-injury scores. Depression rates can be high in collegiate athletes and can also affect their athletic identity. Social support is important for all injured athletes when going through the recovery process. This is especially true for an ACL deficient athlete because close to half will become depressed. Many athletes will talk to their athletic trainer about issues, but sometimes athletes need others to identify with. For example, if someone has torn their ACL and then they receive surgery, it would be helpful to know someone that they can relate with, that has been in their shoes, and that they can see that recovery and return to sport is possible. Athletic trainers are often caught up in the physical aspect of returning an athlete to sport, but the psychosocial side is just as important. Next to coaches, athletic trainers spend countless hours with their athletes and often form close relationships with them. Coaches should also be aware of the concussion signs and symptoms and the common misconceptions about concussion, such as always having to lose consciousness. Education is the main way to inform parents, coaches, and athletes about the signs and symptoms of concussions. A mandatory meeting should be held at the beginning of every year, and athletes and parents should have to sign a form stating that they understand the signs and symptoms and the importance of reporting their concussion. According to Broglio et al., 2014, many athletes say that they would report a concussion if they knew the signs and symptoms, and education can be an effective way of increasing their knowledge. Athletes with ACL injuries should be monitored closely throughout their rehab process so depression can be identified in its early stages. In summary, depression rates can vary between athletes with concussions and those with ACL injuries, and it often deals with the severity. Due to the need of surgery in ACL-injured athletes, they take much longer to return to sport than those with concussions. The implementation of the CESD scale was beneficial in identifying those with increased depression symptoms compared to baseline. Depression can be the result of an athlete's inability to cope with the stress of being injured. The next two slides contain the references used throughout the presentation.